health matters, and your health matters to me. Every breath, every choice.
Welcome to Health Matters, a series exploring issues shaping health services and health outcomes in our community. In this video, Macon County Healthcare Authority Chairwoman Bernice Frazier and State Representative Pebblin Warren start with a conversation about setting the record straight to combat misinformation and end by discussing the importance of sharing family history with younger generations. They also addressed the Healthcare Authority's pursuit of funding to provide prenatal care to pregnant women in Macon County. Thanks for tuning in to today's edition of Health Matters.
And so that's one of the goals that we have, to try to get information out. Misinformation is out there. People always say, oh, nothing has happened, nobody's doing anything. But if you look closely, you'll see that a lot of things are going on. We're looking to, in this second round of funding, we're going after the maternal and fetal. And what we want to do is have a prenatal clinic at Thomas Reed. But we don't have a hospital where we can have births, but we can do prenatal. Because when we did our research, we found out that at East Alabama, most of the young ladies that come from Macon County to have babies have never had prenatal.
I've heard that several times.
Yes, and so
we see so many pregnant women from Macon County for the first time when they come to the delivery.
That's right.
And another thing too, and I haven't heard a lot about it around here, but it's very popular in a lot of places, are midwives.
Oh yeah, and that's what we've incorporated in.
And Tuskegee started, Tuskegee University.
That's right.
At the first midwife training in this state. So I think as we look at it, and when I've been talking to some folks about my growing up and where I was from, in our community we had this one lady, her name I'll never forget it, was Miss Rosa Ford. She was the midwife for the area where I was born. I mean, she birthed all those kids, and it went well. And you have people now who are preferring to have midwives that can't get them here in Alabama, that's going to other states having their babies. And like I said, we're losing the population because that birth is going to another state and not coming here. And I would love for us to look into the midwife in the future as we're trying to deal with some of the girls, and just have somebody locally here that won't have to go anywhere. You can sit here and have your babies at home. Really save you some money, save state Medicaid money
exactly.
to deal with that.
And we are incorporating that. And the director of nursing at Tuskegee University is also a certified midwife. Okay. And so we're working with the RN department as we formulated this grant to have some midwives at our prenatal clinic and to work with them. And so we're really excited about that component. But again, excuse me. But again, our thing is letting people know and getting the correct information out and not false information, and letting people know that you have some people in the background. Most of the time, my grandmother used to tell me, the empty wagon makes the most noise. So if you full and you taking care of business, you don't have time to be running your mouth. So a lot of things that people have their heads down, and I see that in you a lot. You have your head down to the grinding stone. You're not out there trying to do public relations and doing interviews all the time, and I had to drag you in here to do this one because you had so many different obligations that you have. But I feel fortunate that you feel that I'm a friend. Yes. And that you would come and take this time with me.
As I look over my career and things, and this happens as you get older. You have to look back.
Right.
See where you came from, all the things you had to go through to get to where you are. And as I look at it, I said, we've done a lot. I said, I think I've contributed to a lot. There's still a lot more that needs to be done. And I try, every day I talk to people, I try to encourage people to get involved in your community. Do things. Right now we're dealing with the Get Out to Vote campaign. We met yesterday with some ministers locally. We can't sit back and wait on people to do what we need to do for ourselves.
Right.
And I think, and it's a mentality. It's a mentality that we're going to have to change. And I really think that what's going on now with the Republican leadership, they're going to change it because they're slowly trying to take away all these free assistance programs and say, no, you can't do this. I was reading something yesterday about the seniors that are losing Medicare, not Medicaid, Medicare, under some of these guidelines and things they're putting out there. So, you know, it's now time for us, and really as a race of people, because I came up when we didn't have no food stamps, no welfare, but we never, ever used the word poor.
Right. Exactly.
We never looked at ourselves as being poor. We were living, you know, our family, they were providing clothes for us, sending us to school, feeding us, but we also, they instill the work ethics in us. And I tell people, my dad died when I was 6 years and 6 days, and I had a single mom with an 8th grade education. So, you know, she wasn't out there doing fancy work. She was working in cafeterias, she was working in plants, she was cleaning folks' houses. And she always told us, she said, Pebblin, to get anything, you've got to work for it. And you got to be responsible for your own self. Nobody but yourself. And I think we saw that in black communities. We saw people working, doing what they had to do, raising their children. Now that is not even a part of our lifestyle anymore.
Right. You know, when I was growing up, we had to develop work ethics. We also had a hardcore about voting.
Oh, definitely.
In our family, it was voting day was a special event. And so when you turned 18 and you could go vote, you got your favorite dinner. It was like a graduation, and I couldn't wait until, because I was seeing all of my uncles and cousins, and they were, you know, it's voting day and everybody goes vote. And I couldn't wait until I could go vote. And since I was 18, I have never missed voting 1 year. No matter where I live, if it had to be absentee, I really like to go vote in person because I just like to go in and pull the lever. But I have never missed voting. But that's something we have not incorporated in our children. To me, it's almost like, it's like going to church. It's if I don't vote, it's like, oh, you know, there's a feeling that I get that you didn't go vote. How can you face people you didn't go vote?
And dealing with kids today, and I tried to, my kids, when they moved away from me in Alabama, it was just a heartbreaker. But when I get a chance to see them and talk to them, and I see what environment they're in now, they really can't even conceive of what we went through. Mm-hmm. You know, their best friends, white, this one doing this with white folks and that folks, and they just think it's a given. And I constantly remind them, and I'm looking at them, all the they're saying, Granny keep talking about this stuff, but we don't want to hear this stuff and what she's talking about. But that's where, and now I'm also planning what we're going to have family nights. And I told them I'm going to give them my history and legacy from beginning to end. I'm going to let Dave sit down and give them his legacy from beginning to end, because my kids just discovered within the last 2 months I was born in Georgia. Well, you're not from Alabama. I said, no. I said, I was in Georgia. So, I mean, I'm getting a family plan now. I'm going to take them to where I was born. I'm going to show them everything and just make them see, you know, where you are. It's a different day. It's a different time. But we got to keep our kids very mindful of our history.
Health matters.